Welcome back to the Teggatz Clinic. I'm Linnea, the nurse and health coach, and I have Dr. Teggatz here with me.
Hello.
So Dr. Teggatz, you talked about all the different causes there are. We've talked about the lab results, that there's TSH, T4, T3, free teeth. There's so many things that are going on. How do we treat hypothyroidism?
The foundational approach that I like to take is, looking at the root cause. So first of all, it's very individualized. But the things that will be common to each patient: optimize sleep, optimize their movement. We all need to move our bodies. Sometimes we don't move them enough. Optimizing nutrition, which is probably the biggest piece, and that's where you help me the most. Stress management, and actually that can be huge, but that can really move the needle when we help patients with their stress management. The areas that we really dive deep into, gut health. That is just super important. So what you're putting into your mouth, but then also how your gut is functioning and are you able to absorb all the nutrients that you need. The other piece with the gut is the immune system. Hashimotos or autoimmune thyroiditis is the most common cause of low thyroid. So that's when your immune system is producing antibodies against your thyroid. So 70% of our immune system lie just inside our gut. So if we don't have good gut health, that can affect your immune system. And the other thing is medication. If thyroid hormone is low and we optimize everything, but the thyroid is still not producing enough thyroid hormone, we are lucky to have medications available. And there are basically two different types of medications. There are synthetic or man-made medications, and there are natural thyroid hormone medications. So both are regulated by the FDA. The two synthetic types of medications are Synthroid, which is T4, and like we talked about earlier, T4 is not active. It relies on your body's ability to convert it to the active form T3. There is liothyronine. One name brand is called Cytomel, and that is actually T3. So if someone is not able to convert their T4 to the active T3, I will sometimes use liothyronine or Cytomel. The natural thyroid hormone, it comes from pigs. They purify pigs' thyroid glands. And the nice thing about that is it has both the T4 and the T3 components in it. I get a lot of patients who will come to me already on the levothyroxine or Synthroid. It's actually the most prescribed medication in the United States is levothyroxine. So there are a lot of people out there on levothyroxine, and it works perfectly fine for a lot of people if their body is able to convert it from it is T4 to T3. But when that doesn't happen, I see a lot of patients who have the low T3 and Synthroid or levothyroxine isn't working well. So I often will change them to natural desiccated thyroid hormone, and they often see a night and day difference because they're getting the active thyroid hormone. Medication, it does play a role. I would prefer if we can get the thyroid functioning normally and not need medication, but that's not always the case. If your thyroid hormone, if tissue's been destroyed and you're just at a level that you need medication.
We're here to support you in your thyroid health as well as all of your other health and functional medicine needs. So give us a call and we'd be happy to help.
Thank you.